Hello everyone, I'm Rodney Ford. Today I want to talk about opioid drugs and the epidemic that's come from these drugs. I want to make as many people aware of the risk as I can, and obviously I'm not a medical professional, but I do want to share this because obviously I've shared my struggle with addiction with you in the past, and also I have lost a couple of friends to the opioid drugs, the class of drugs, either through overdose or through suicide due to the addiction. So some of the main points I'm going to go over today are what is an opioid, and we'll go over some statistics. Also, how does one become addicted? If we know these risks are there, why are so many people becoming addicted to these drugs? And also we'll discuss briefly some of the things that are being done to curb this trend. So an opioid is a very strong painkiller. There's two different classes to the opioids. They are opium derived, and then your synthetic. The opium derived are the ones that generally most people, the general population, would consider dangerous. They being your morphine and your heroin. So I think it's pretty much general knowledge that those are pretty dangerous drugs. But then you also have your synthetics. These are the ones that some people might not see as a risk. And these include Oxycontin, Percocet, hydrocodone, and then fentanyl, which we'll touch on that one here in a minute. Some statistics for these opioids and addiction in general. So drug overdoses have become the leading cause of death for the age group under 50. So this has surpassed both auto accidents and guns. So it's came up quite a bit the last several years, and 2/3 of these overdoses are from opioids. So 2016, we had 62,000 Americans died from overdoses. That is more than both the Vietnam and the Iraqi war combined. 2017, the FDA cited opioid addiction as its biggest crisis. So if these risks are there, how have so many become addicted? So the main reason is unawareness, honestly, in my opinion. Many people think that just because a doctor prescribes something, it's got to be safe. So, and also twofold. Number one, it's got to be safe, and if a doctor tells me about it, tells me I need it, it must be true. I must need it. So, also paired with that is the length of time you are on an opioid. So another interesting statistic is if you were on an opioid drug for more than 3 months, 3 months seems to be the magic number. If you're prescribed a drug for more than 3 months, your rate or your risk of addiction jumps 15-fold. So what is being done about it? So in 2010, the government really began to crack down on opioids and the overprescription of opioids. This has caused, so I'm kind of a visual person, so this has caused something interesting. So this chart shows the deaths per 100,000 capita, 1 through 11, and then this is by year right here. So this is your commonly prescribed drugs, opiates, which is your natural and your semi, which is your synthetic opioids and your methadone. So as you can see, up through 2010, 2011, it was a pretty steady increase, and then it kind of stabilized. This is when the government started cracking down and trying to curb this increase right here. The unintended effect, though, as 2010 heroin is this blue line. It was very low, less than 1 per 100,000. 1 is too many, but still it was pretty consistent. It was really consistent, less than 1. until 2010 when the government began to crack down up here on the prescriptions. So the unintended effect was all of these up here that were addicted, they began to seek to feed that addiction elsewhere, being heroin, and then also this one, this orange line is fentanyl. That's the drug, many of you have probably heard of that drug. That's the one that killed Michael Jackson. So this is just an interesting chart for me. As I said, I'm a visual learner, so I like data. All right, so some more stats. 2016, Congress passed the 21st Century Cures Act. So what that did is that gave $1 billion to your states so they could combat this epidemic or crisis at the local level. In 2017, the FDA director, Dr. Scott Gottlieb, stated that the opioid addiction had become the FDA's biggest crisis. So, and that was just earlier this year. So it's definitely still an issue. The prescription drug monitoring programs, which is kind of a fallout from the Century Cures Act, but that program is now active in all states. So what this does is this kind of limits the ability for patients or addicts, however you look at it, to get these drugs. So what it does is it gives visibility for the pharmacist and the doctors for their patients. It gives a history of these prescriptions, so they can tell if there's some suspicious activity or just the history of somebody's use. So in the past, people were doctor shopping, so they might have 3 different prescriptions from 3 different doctors for the same medication. So this visibility has helped curb that trend. So some other things, some other treatment options that are out there to fight this epidemic or crisis is there's generally basically 2 different types. You've got your medical and then you've got your behavioral treatments. So your medical treatment would be like a methadone. Someone that's addicted to an opiate might go to a methadone clinic. So the methadone is something that is prescribed. It's a daily dose, but what it does is it curbs the withdrawal symptoms. So it helps the addict deal with the cravings and just the withdrawals in general. And then another thing, naloxone, which is a kind of a newer drug. It's been in the news a lot lately. That's something that the first responders, your police, your EMTs, your fire departments, they're carrying it a lot now. What it does is if they respond to a call and somebody has OD'd, this kind of eliminates the effects of that overdose. So it kind of stabilizes the patient, and it's actually saving quite a few lives right now. On top of the medical treatments, there's also some behavioral treatments. These being your treatment centers, maybe Lakeside or Bradford Health, or there's hundreds of them. They're pretty popular these days with all the addiction that's going on. And you've also got your 12-step programs like your AA, Alcoholics Anonymous, or your Narcotics Anonymous. So that's a little bit of information that I wanted to share with you today. Again, the purpose of this was to just kind of open your eyes and just be mindful. So obviously a doctor knows or a doctor or a pharmacist knows a whole lot more about these drugs than I do. But I want to challenge you to just ask your medical professionals if that's the right medication, if they do prescribe it to you. Ask them maybe if there's an alternative that maybe non-narcotic that you can use. And at minimum, I want you to just be aware of the 3-month, the 3-month window. So remember, if you are on an opiate for more than 3 months, your addiction rate jumps 15-fold after 3 months. So just wanted to share that with you, and God bless you, and you'll have a wonderful evening.